prudent for the committee to have those very key documents that you did request to be submitted to you by the Department of Health.
Waziri.
Thank you, Chair, Honorable Member. To the Honorable Member, indeed, in our first letter, we requested for more time, and we asked for 2 meetings. The first meeting was with our sub-county teams, and the second meeting, Chair, Honorable Members, was last week on Monday with our the health administrators of all the 24 level 4 facilities. The reason for the 2 meetings was for us to be able to go through the documentation. Now, indeed, when the health administrative officers from the level 4 facilities came, they came with some of the documents, but what they brought was not adequate. It was not, the documents were not complete. We held the meeting, and the meeting ended, I think, lasted until 8 p.m. in our boardroom. But at the end of that, we were still not able to get all the documentation. And what I realized then, Chair, Honorable Members, was I actually needed to constitute a team from the county, the CHMT, the County Health Management team, to divide them into teams so that at least now we are able to visit by sub-counties and get verification, develop a framework, get verification, and go through these documents. As you are aware, Chair and Honorable Members, we issue AIEs every month to these facilities. And so getting the documentation and the paperwork for all this is something that would take time. So that is why, Chair, Honorable Members, in my last letter, which was done at 8 p.m. in my office just before I left the office on Monday, was again a request for more time. The reason at that point I did not give an indication of when was because I realized that the exercise was so enormous that it would not be possible for us to get those documents within a certain number of days. So I had intended for us to begin the exercise, and then within that time, once maybe we've done a day or 2, we'd be able to know how much time then we would need to complete the exercise. As you know, as you notice, Chair and Honorable Members, this is sort of an audit on its own. And since my team, my CHMT team, is not really qualified to do the audit, would need support from the other departments, because we cannot depend then on the people in these facilities to give us the same document. If we are trying to do a verification exercise, it would actually then be a fatal flaw in the approach and in the method in which we carry this out. However, Chair, 2 days later after our letter, I received a letter from the clerk demanding that directing that we appear today, failure to which certain sections of the standing orders of the county assembly would apply. Therefore, when such a letter is written, Chair and Honorable Members, we know the law. There is no way I could now respond. The only response I could give to that letter from the clerk was to appear. And so even my submission that the documentation is incomplete and I would require more time could only have been done at this hearing, which we are now present. Chair and Honorable Members, I submit.
Chair, from the look of things, the ministry is not taking this county assembly serious, because when you look at, whenever there is the members demand to know the utilization of FIF fund, it was a topic of concern from members. This is what prompted the committee to do a letter to the department. And I think this thing was done almost a month ago. The custodian of all these documents, the custodian is the department. The CEC, if I may ask, all these things which members requested, the committee requested, do you think whatever you have provided us with is sufficient for us to interrogate your department? Because we are talking about a total of about 800, and what was collected is 833 million for the entire financial year. The information you have given us, do you think it is enough for us to interrogate the department? Chair, if I may ask before I proceed to ask another question. Because to me, I think the department is not serious. We asked for certified bank statement or special purpose account. The financial report, we have an internal auditor in this county. One of the reasons why the county government thought it wise to have an internal auditor is to make sure at least quarterly, there must be a quarterly report from the internal auditor. You cannot pile everything for 12 months is when the internal auditor wants to start audit the accounts for the FIF. After the Committee of Health, I've done a letter to the department. This is the time when the internal auditor wants to do want to audit the FIF account. So there is no audit report, and the report on the supply of pharmaceutical, which is very important to this county assembly. I've seen what has been annexed here in your report. Do you think it is enough for us to engage, or for you to engage this Committee of Health, Honorable CC?
I thank you, Chair and honorable members. Chair, the document that I submitted was a financial report. The financial report is an aggregation of all the AIEs that we have issued to our level 4 facilities. And what we did as a department, and Chair, I really want to submit that we took this exercise extremely seriously. And we take the role of both the Health Committee and the Assembly in oversighting us very seriously. And I want to go on record, Chair, that the position that the honorable member has proposed is not the case. We take the workings of this committee and the Assembly extremely, extremely seriously. We are giving a service to the people. As I have always said, I will restate, you are the ones with the power of the people. You're the ones who hold power on behalf of the people. We are simply appointed to execute that power on behalf of the people whom you represent. So yes, we take the authority and the work of this committee and the Assembly very seriously. What we have tried to do in the time that was available to us was to aggregate the AIEs that we have issued. And we've collected all the AIEs, and that is why, for instance, if you look at the first page, we have medical drugs worth 79 million, which is the amount that these facilities use to buy drugs. What I'm saying we were unable to get in this interim period, Chair and honorable members, was the exact list of these drugs, where they were bought, and so on and so forth. As to the issue of audit, yes, we do have an internal auditor in the Department of Health. And every month before we issue the next AIE, there is a surrender. But Chair and honorable members, a surrender of an AIE, as we all know, is simply the receipt. This is what we ordered and this is what we received in terms of pharmaceuticals. This is the number of casual laborers we said we would pay, and this is the number that we paid, and this is the evidence, whether we paid them through M-Pesa, whether we paid them through an account, and so on and so forth. But I think what we as a department interpreted the letter, the initial letter from the clerk to mean was that you needed further details. So for instance, where I have medical drugs at 79 million, we assumed that the committee wanted to know, in this 79, how much did Ogongo buy? How much did Mbita Sub-County Hospital spend? How much did Rachonyo South spend? How much did Ndewa Sub-County Hospital spend? And this is what I am saying we were unable to get in this time. Because then what I would be sending my officers out to do, and the team that we constitute, would be to say, so Ndewa, you say that in this year you spent 8 million in this quarter for drugs. Where is the list? Where is the list of supplies? Where is your goods received voucher? Where is the stock card, the initial and the end stock card for this period? And this is the exercise, Chair and honorable members, that I'm saying it was not possible for us to do in this time. But in terms of keeping track of what happens in our facilities, yes, as a department we do, and we are held accountable just as we hold them accountable onwards. So it is just that the details were not there. But if you look at the list of the financial, the detailed description of item of expenditure, we have tried. What we needed to do then is, for instance, when you say casual labor wages, total 27 million. We need to know who was paid and how much were the casual laborers in Rangwe paid, and so on and so forth. I submit.
Chair, CEC, after how long does...
Chair, point of order. Chair, I'm worried that I don't know whether we are proceeding with the engagement, because what you are talking about in front there, actually we are blank. We don't know the documents you are talking about. We don't know, we don't have any documentation. So if we can be supplied with the documentation, then we'll be able to engage. Thank you, Chair.
Is it in the soft copy? Okay. Let me share.
Yes, Chair, that is the detailed description of item expenditure.
Waziri, do we, in your department, do you people have monthly reports? And then, what I want you to answer, the internal audit. Do we have quarterly audit? Or we wait up to the end of financial year? Is when they do the internal audit.
Thank you, Chair. As a department, we have monthly reports for all the department. We have a monthly report for promotive and preventive. We have a monthly report for curative and rehabilitation services. And we also, of course, have the financial and administrative reports. So we have that on a monthly report. In terms of internal auditing, auditing is done once a year, to the best of my understanding, unless a department makes a request for an audit. But the audit is normally done at the end of the financial year. I submit.
On John.
Thank you so much, Chair, and thank you for the response. Now we have the documents in soft copy. Honorable Chair, we had invited the committee now thrice, and they've come. Chair, from the look of things, I'll humbly request my colleagues and your Chair that for us to engage effectively, Chair, we need those documents. Because if you don't get those documents, then our objective for this engagement will be lost. So I want us to agree with the department, now that Waziri has submitted that she is taking this assembly and the committee seriously. I don't even see the need of those many questions. I suggest that we agree, if according to the department, our letters did not specify, then we give specifications of what we want as an assembly, and then we agree on the timelines. So, Chair, when they will be coming, so that we don't have any excuse again, because, Chair, our health facilities are doing badly in terms of drugs and even other supplies. And that is the reason why we wanted to engage, and we are not witch hunting, so that we provide quality services, health services to our people. So I'll request that the department and us give them a duration, so that when they will come, Chair, we don't miss even one document. Otherwise, we are asking many questions, and even the statement of this account is lacking, which is very vital, Chair. So that is my proposal, that those questions should come after they provided us with all the documents that we wanted, Chair. Otherwise, I don't see the need of engaging further. Thank you, Chair.
Thank you. On John. Oh, Daktari.
Thank you, Chair. Members of the Health Department. CEC, did you say that you're not able to get monthly bank statements because everything is controlled from the Office of the CEC Finance? As you respond to that, then I will ask my question.
Thank you, Chair. Honorable members, I did not say that we are not able to get monthly bank statements. I said that for us to get the bank statement for the whole time, because the special purpose account was opened a year ago, and the last and the final the three signatories are the director, the chief officer, and the chief officer finance. So the final approver, the final signatory, is the chief officer finance. So whenever we require a statement, and we have not required a statement before for the special purpose account, we have to request for finance. Thank you.
So, Waziri, did you request for those statements and it was not availed in the last month that we requested your department to provide those documents?
Thank you, Chair, honorable members. One of the documents that I submitted that is not in the consolidated document which I shared in soft is a request for a certified bank statement from our chief officer to the chief officer finance, written on the 5th of August 2024 and received in the office of the chief officer finance on that same date. So yes, we did make a request. I submit.
Chair, there seems to be a disconnect between the Office of Waziri Finance and Waziri Health in terms of availing necessary documents. As far as we know, if I request for a certified bank statement for an account, whether it's individual or it's corporate, it should be available at least within the 3 days. So I think, as Mheshimiwa Joan has said, we probably need to give them more time to put their house in order. And as they do so, I would like to ask the Director of Finance to also give a response, that a certified response to what the CEC has said about the statements from the bank.
Thank you, Chair. I think what Waziri has said, all the statements are yet to be received as per the letter that was request that was made. So we'll get all the responses on the statement, the certified statement, bank statement, as soon as we get that. Thank you.
Lazaro first, Django.
Thank you, Chair. Mine is very short. My able minister has said he has taken this committee very seriously. I would like to know, because we are talking about absence of bank statement, certified bank statement, which was supposed to be provided to your office by the Chief Officer Finance. Without interpreting that our Chief Officer Finance is not interested in the welfare or in the health services being provided to our people of Homa Bay. In which form of communication did you use? Or did you request it verbally, or you used a letter, so that we can at least blame the Minister for Finance for having failed to provide you with a certified bank statement, or it was verbal? Chair,
Chair.
is that a letter which was written by Minister of Health to Minister of Finance to provide the bank statement? Have you read it?
It is being scanned, going through it.
Can it be read? Before I ask my question.
Honorable Jango.
And did he respond? Because if you wrote, then he ought to have responded so that we view the content, why he's not able to give you a certified bank statement and he knew that you are to report to this Honorable Assembly. Chair, that is my concern.
Thank you, Honorable
Yes.
Lazaro.
Honorable Chair,
Yeah.
I can see a request of certified bank statement from the Department of Health. They did a letter from the Chief Officer Health on 3rd, on 5th, and the letter was received on the same date, on 5th of August. What the department needs to tell us, was there any communication from the finance department in regards to this request? Chair,
Okay.
Chair,
Yeah.
I've looked at what the committee requested vis-a-vis what the department has provided. They've given us a very scanty information, which we cannot use to engage them, because they need to demonstrate if contractual labor wages, how they spend this whole amount of 833 million. And I think a bank statement is a public document, honorable members. And you know, this is an oversight body, the county assembly. When county assembly requests something, especially bank account where the public money is being channeled to, Chair, I wonder why it has to be an uphill task, Honorable Chair. So my plea as a chair, because it is you who will make a decision, let the department request how many number of days do they require so that they can appear before this committee when they are well prepared. Because, Chair, this issue of FIF, it is not a small issue. And all of us knows very well that at one point, there was a letter which was leaked just concerning this FIF. So when we as an oversight body, we have requested for some documents, Chair, then we have to put our feet down for us to ensure that we get those documents so that we can interrogate the department properly. Because currently there are no drugs in our stores, even the dispensary and health centers. That is my submission, Chair. Chair, even the EACC went to Magina Health Center. So some of these things, when we are requesting them, we are not doing that. We are not doing that to maybe to pin anybody, but we need to be at par with the department, Honorable Chair.
Okay. Before I make a ruling, let me have the Deputy Speaker, then Whip, and on Odongo, then I'll conclude.
Thank you so much, Chair. I would just like to know from the department, it's true that they made a letter requesting the bank statement. Did they get any communication as a reply to the letter that they wrote? I would like them to answer that. Two, as assembly, we have a timeline of doing things. And as health committee, we have to oversight the department. And we cannot do oversight without these important documents. So I believe if they are not ready with them now, they should tell us when they are supposed to bring them. Because me as the liaison chair, I will also expect your committee to perform, because I also need a report from you. So if we keep on dragging on these issues, then we will not make any progress. You are aware there are challenges in their facilities. When we started, it was so well, but of late, the performance is going down according to what's on the ground. So they need to tell us how much time they need to bring those documents so that we can move forward, so that our work of oversight as health committee is not stagnated. Thank you, Chair.
Thank you, Chair. Mine is also not far away from what the DS has said. As an oversight body, we need to engage constructively and objectively. And we cannot do this without these important documents. It is very true that health sector or health services are deteriorated right from our level 2, level 3, and level 4. And Honorable Chair, this outcry is all over. Seemingly the department is not sensitive about this. So for us to attain an objective financial report, we must have a certified bank account statement. So I would suggest that we give the department time for them to go and come when they are prepared. And we must have a timeline, a commitment done on us today. Thank you.
Nodongo.
Oh, thank you, Chairman. Chair, this is my concern. As already indicated by the CCM that we are not having the requisite tools for us to execute this matter. So I feel that it is important we give them time so that they come with all the required documents. They will know there's no way we'll tackle this issue without proper tools. So, Chair, my concern is, even I know, and I'm already reading for you from your eyes the direction you are taking. Just rule immediately.
Before I rule the guy, Honorable Adinda is there. Let's hear from him.
You know, Chair, thank you for giving me this time. Before you rule, I just need to ask some questions. Now, I was once told, if you give someone without tooth sugarcane, it is an insult. If you check the document which we are given, it is a financial tabulations. There is wages for contractual laborers, there is casual laborers, electricity. If you check this thing well, these figures must be taken from a financial statement. So where did they get these figures from? First, it means there is a statement. So where is the statement? Because all these tabulations are from a financial document. You can't know if you check before the tabulations, they even know the income from NHIF, they know the cash paid, they know the expenditure, the tabulations balance, and at the end, there is a balance report. It means it came from somewhere. So where did it come from? It means the statement. So can they produce the statement? Because Chair was just waiting. Second thing, if you've not gone deep into this FIF thing, I would like the department to tell us what FIF should do and the budget that we give the department should do. Because I'm seeing some of the recurrent expenditure which should come from the department are within the tabulations. What are the differences between the tabulations, the FIF money and the department money? Because under the health department, we give them a budget of around 2.3 billion, both the recurrent and the development money. What should it do? Thank you.
There are so many questions that we can still continue asking the department, but I want to make a ruling because there are a lot. The department should even know, Chief and Waziri, that the financial year has just ended and the audit exercise is already ongoing. And again, if you look at the FIF Act, I would have asked the Chief Officer, who are the mandatory signatories of FIF? You'll realize that the mandatory signatories are Chief Officer Health and Chief Officer Finance. But let me take it this way. Based on the information that we've gotten, and we've realized that the information that you've given us ain't sufficient, we're sending you back. Go get yourself prepared, and we will need you back again. I just want Waziri to give us the number of days they want us to give them so that they give us all this. We need these certified documents. If you come here without those documents that were listed, and we even add some, we will send you back, and as you've been told, the consequences now might be dire. So we're sending you back. Go get yourself set, then you will come before us again. So you need to commit yourself on the specific time that you want us to give you so that you can prepare yourself and appear before us. Waziri?
Thank you, Chair. Chair, before the commitment, am I allowed to make a remark? Thank you. So, Chair, honorable members, I think, again, I repeat that I take the committee very seriously and the role of the Assembly very seriously. I just want to point out 3 key issues. One, that every month we have a revenue roundtable, which all honorable members are aware. Now, there's what we bill to NHIF in terms of inpatient and the number of visits that patients make to our hospital. So that is what we aggregate and project as revenue. But a lot of times, once this is billed and sent to NHIF, it's not all paid. So even right now, as we speak, Chair and honorable members, the amount that was declared as revenue raised for FIF is not the same amount that we are accounting for. Some of the monies have not been received from NHIF. They are still out there. So I think when we get the financial statements, this will be clearer. That is the first point. On the second point, I want to say that, yes, we are aware that EACC has been visiting our facilities. But I want to clarify that it has nothing to do with our FIF. It has everything to do with the fact that in the transition, when NHIF was transitioning to Social Health Authority, they themselves as NHIF decided to do an audit of the fund, which is a requirement by the PFM. Before you wind up a farm, you must have a closing audit. The two things that were contentious was Linda Mama and Eduafia. So even if you were to go back to our facilities to ask, it has nothing to do with Homa Bay as a county or Homa Bay FIF. This is an audit that was done in all the counties, in all the 47 counties, even those that have not implemented or that have not passed their FIF acts. So it has nothing to do with us, but because we are recipients of NHIF funds, our facilities were targeted. And then lastly, Chair, honorable members, FIF only applies to our 24 level 4 facilities, 23 level 4 facilities, and our referral hospital. So the level 2 and level 3 dispensary, health centers and dispensaries are not covered. So even as we go to do the audit, I just want to request that we get that clarification, that FIF refers to the 24. So the information that we will be providing and what we have provided is for the level 4 facilities, which, as we all know, have not been receiving any grants, apart from the salaries that we pay to the workers, the health workers in those facilities. They have not received any grants, not medicine, not cleaners, nothing, not even lab reagents from us as a department. And I think that was something that we discussed in a different committee of the House, and that's the budget committee. That because the 24 level 4s are receiving some money, let us leave what we get from the shareable revenue to the level 2 and level 3s, which again we have had challenges of exchequer releases, but that's a separate matter. Lastly, Chair and honorable members, on the issue of when we would be ready, I request that you give us at least 10 working days, so that would be 2 weeks. So like anytime after the 12th of October, we will be able and ready to come. Sorry, September. I beg your pardon.
Chair, before you conclude.
Thank you, Chair.
Before you conclude, please. I know you've made a ruling, but depending on what she has said, it needs clarification. Do you allow me? Thank you, Chair. Waziri, I'm pleased with your response, but I take exceptions to your last statement that FIF refers to level 4 and level 3. But in the FIF document, which is now the Act, it clearly states, Section 5, this Act applies to the following county health facilities. One is county referral hospital, sub-county hospital, health centers, dispensaries, which you are excluding in your response. So kindly note, and even public health services, it goes down. So when you will be giving, the reason why I wanted to clarify this is you may be able to give us reports that will be scanty and excluding dispensaries and public health services. We want you to come back with a detailed report with knowledge. And also to note that there are roles in the FIF, the roles of the CCM, and there are the roles of the chief officer. Those roles, note them in the FIF. When we're giving response, they should be in respect of your roles. Thank you.
Thank you,
Chair, a concern before you rule. Chair, the department has requested for 10 working days. Chair, now that we had given them earlier, we had summoned them and they had started the process. Chair, I think 7 working days will be enough. I don't know you'll rule, but may I feel that if we give them 7 working days, that will be enough. That is my proposal, Chair. Thank you.
Okay, let me rule on that and then we move on. I'm giving them 10 working days. So we agree on the date. Clerk, can you check on? Let's give them 10 working days so that they don't come up with a lot of excuses. Yeah. Waziri, this time round,
Chair,
it will be a different ball.
I'm guided.
Okay. So we will be meeting the department on 10th September. That will be the 10 working days. Okay. So,
Time?
Tuesday. The time will be same time. That should be 11 a.m. So we done. Being no any other business, this meeting stands adjourned until that Tuesday, the 10th. Okay. Honorable members to remain while the department leaves.